One of the questions I get asked all the time is, are there any supplements that can improve your heart health? Actually, one of my subscribers sent me a picture of this guy called Dr. Anthony something or other, and he sells this heart supplement. Obviously, supplements is a huge industry. It's in the billions and billions of dollars, probably 50 to 70 billion, maybe more. People buy vitamins and minerals and supplements and this thing and that thing. Unfortunately, most vitamins are scams. I'm just going to say it straight up like it is. There is no thing that comes in a bottle that you could buy at the pharmacy in the vitamin area that is a supplement for your heart. The only proven things that help heart health are things that reduce cardiovascular mortality. If you have actual disease like hypertension, we got to get your hypertension down. If you have diabetes, we got to fix that. If you have other diseases, taking care of those other diseases will help improve your cardiovascular mortality. But in terms of supplements, there's really not a whole lot. And all of the supplements that we have found that actually do reduce cardiovascular mortality, we've actually turned them into medications. They are actually medications. For example, oil of wintergreen, which is found in the bark of a willow tree, is salicylic acid, or aspirin. It's called aspirin. Sweet clover can help with clotting disorders and cure certain disease states. That's called Coumadin. The foxglove plant can help with certain cardiac arrhythmias too, and it decreases hospitalizations if you have heart failure. That's called digoxin. It comes from the foxglove plant. Like I always talk about, viper venom reduces cardiovascular mortality, reduces kidney disease, improves kidney function, especially if you're diabetic, and it comes from viper venom, and we call that lisinopril. It's an excellent medication. Most people take it. Now, there have been some things that are like, okay, what about fish oil? Because the guy has on the list of ingredients fish oil. So we did make fish oil into a prescription called Lovaza. People remember this probably 10, 15 years ago. The problem turned out that it actually raised your LDL. It was a combination of EPA and DHA, and it raised your LDL, which is even worse. So it didn't work. So more recently, they decided, well, what if we use just EPA? Okay, so throw out the DHA. What if we use just EPA? And they did that. And it actually turned out to have phenomenal results. 22% reduction in cardiovascular mortality, 20 some odd percent reduction in all-cause mortality, like dying from anything. And it actually worked. So now it's a prescription medication called Vascepa. Now, people are going to say, what about turmeric and curcumin and, all these anti-inflammatory things that people put in these heart supplements. If the studies were solid and showed consistent and reproducible results, they would already be a medication, and it would be highly controlled substance. Now, you guys are thinking, well, why should we listen to Big Pharma and have Big Pharma make medications? No, it's not about Big Pharma. These medications cost almost nothing. It's about getting a pure product. They've studied these medications and supplements. There was a study, I think about 10 years ago, maybe a little more than that now, where they went to Walgreens and Walmart and Vitamin Shop and GNC, and they took tons of their vitamins and supplements and tested all of them. 95% of them did not contain what they said they contained, or if they did contain it, it wasn't at the dose or the amount of milligrams that the bottle said. So it's uncontrolled. It's unregulated, uncontrolled. You don't know what you're putting in your body. You're just putting stuff in your body. When we take it and turn it into a medication, you know the exact milligrams. Like statin medications, for example. Red yeast rice is where they come from. That was the original lovastatin. It reduces cholesterol tremendously, especially LDL, your bad cholesterol. That's where we got it from. And then we've since come up with other statins. But all of these things do come from nature somehow. But we purify them and turn them into controlled substances. Imagine if it was unregulated and people would go think they're buying aspirin or lisinopril and they're getting something totally different or not the right dose. You think you're taking Crestor 5 and it turns out to be 50,000. It's just insane. It's super dangerous. So that's kind of my thoughts on that. If whatever supplements, somebody's selling you for heart health or bone health or joint health, it's probably a scam. Until there's more data and more evidence that it actually works and that it actually is something, just save your money. There are some things that are worth taking, like vitamin D and calcium for women. Vitamin D for everybody, but calcium for women. But the vast majority, the rest of the stuff you see out there, probably you're just paying for expensive urine. Your urine comes out orange or green colored, and those are the waste products of whatever chemicals you put in your body. It's funny though, sometimes my patients or people that I talk to are like, hey, I don't want to be putting any, fake minerals or fake stuff or chemicals into my body. I don't want chemicals. They don't want to take prescription medications, but then you go look at their medicine cabinets, it's like 50,000 pills of GNC vitamins and you don't even know what's in it. You're literally putting stuff in your body that you have no clue what is actually in it. Like literally, completely unregulated. Heart health, women's health, bone joint health, this. So you could be taking all this stuff combined and it's probably really bad for you. It's bad for your kidneys, bad for your liver. There have been so many cases of liver failure and kidney failure from people taking stuff that they have no idea what's in it. So what I would recommend is talking to your doctor and physician and getting only on the things that you actually need in doses that are regulated and in doses that have been proven to work. Like lisinopril 5 didn't work for this, but at 20 it did work for this. So those kind of things. Make sure you talk to your physician and get on the right stuff, people. Don't experiment with your body. Don't be putting stuff in your body that literally no one has any idea what it is. All right? Your body's worth more than that. Be careful. Be smart about it. Look at the data. Look at the research and just be smart, okay?